All right, folks, we've moved up my closing remarks so that you don't have to come back to this room after the workshops. All right. So after this session, please pick a workshop to go to and attend to. And then at the end, there's going to be a networking session that really was put forth after all of your feedback from the last forum that you all felt there weren't enough opportunities to meet and greet and learn from each other. So after the second workshop, you guys can grab some really good pastries from the D bar and then come here and converse with people that maybe in your same related arenas or totally different. Again, great opportunity for the last half hour of the session. So for my closing remarks, I wanted to share information that was shared with me. So I am just the messenger of this awesome news. So this comes to us from Courtney Everson, who is my co-chair for the Data and Advisory Group, the Data and Research Advisory Group within Support Colorado. And she wanted to make sure that you all knew about this new tool that was developed as a collaborative effort between CDPHE and the Colorado Evaluation and Action Lab. And it's a new tool that was developed to promote better data-informed policy solutions in maternal health. And this all came to be after there was new legislation that was passed, SB 21-194. And what they demonstrated was that there were 4 clear strategies that Colorado can take to improve evidence-based decision-making in policy and practice and advance equitable opportunities in perinatal health for all families. Now, I'm not going to go into detail here, but here is the QR code. Please scan it and learn more about this awesome resource. The second thing I wanted to pass along comes to us from our partners at CDPHE and HCPUF. This was shared to us by Anushka and her team. And as you all know, Colorado is one of the states that was funded for the Maternal Opioid Misuse Model from CMS, the Center for Medicaid and Medicare Services. And as part of that funding, what they were charged to do, this is HCPUF was charged to do, was really comprehensively assess what are the resources available to pregnant and parenting people who are struggling with substance use in our state. As I've just highlighted, there's a lot of good work happening, but we still are siloed. There's a lot that we don't know. And I know that particularly in the smaller communities, work is happening and we just don't know about it. And so the goal of this effort is to create a very dynamic atlas that documents experiences of people across the state, as well as what resources might be available. And so the hope is that this will then inform future policy programmatic developments. And so what can you do? So this is the ask from Molly and Anushka from HCPUF is here is a resource inventory form. There's the QR code. So at some point today, or perhaps after you go home, please complete this form. And the questions that are asked, are such as, where do you get your SUD burden information? Are there resources in your community that we don't know anything about? And what else do you want to see in this atlas? This is the time to give active feedback. So this final iteration is actually something useful that we can all use. And fingers crossed for sustained funding that in fact, this tool will be longitudinal and updated in a timely fashion moving forward. So lastly, last QR code is the feedback survey, as well as the site level survey. So the forum feedback on the right, please give honest feedback about what you've seen and heard. You haven't yet gone to the workshop, so fill this out at the end, because literally what you guys rate high and low and all the qualitative feedback that you give informs what we plan for the next forum. So the format that you see today, the content from today, was based upon all the feedback that you gave from the April forum. Site level survey. For those of you that work in hospital settings, we want to know what's happening. We have patient level data as I shared with you at the beginning of the morning, but we want to know what's happening kind of at a systems level around policies and guidelines, around workforce, etc. So if you're at a hospital, please fill this out and we'll be sure to share the results with you the next time we meet. Finally, this work cannot happen without collaboration that continues in a very fruitful manner between Chosen Quick, Illuminate, our CU Department of Pediatrics and CPC-QC, and all the individuals that you see listed here have made today and the work that you've heard about possible. I would like to highlight Rebecca Guili from our Chosen Quick Steering Committee and Christina from Illuminate Colorado, who worked tirelessly the last several days and probably weeks in putting this forum together. So thank you so much. We really appreciate your participation. And Christina is saying, don't leave yet. Okay, let's see.
So for virtual participants, we send the link in the chat, and you will need to use the link to be able to see the presentations for all of you virtually attending.
Okay.
So don't ignore the link that Megan sent, please.
So just to reiterate, for those of you that are joining remotely and you picked a workshop, you got to click on the link that was sent to you individually to access the specific workshop in the chat. Okay, perfect. All right. Well, thank you so much. Enjoy the workshops.